we did this, the first 3D patient match reconstruction in all of Southeast Asia at Farrer Park about 2 years ago. So this was it. This was me planning the bone loss and the new implant and the trajectory of the screws. And then we planned with the engineers in the USA, and then they send us all the detailed confirmed planning of the screws and the trajectory. Then we have these 3D printed models, life-size models. This is all the bone that's worn out. This is the proposed implant. And they send us the implants to play with so we can check, make sure we're happy with everything. And then they send us the actual implant. It's customized to the patient. It's the patient's name on it. And then it's very easy with all the customized implants. We can put all the parts in, and then that's the reverse shoulder. This patient had a bad deformity, couldn't raise her arm for 3 years. After this operation in the hospital, already she could raise her arm again. So it is very satisfying to be able to make a change to a patient's life like that. So I would say in our local experience, in the last 5 years, the number of people undergoing shoulder replacements is just increasing tremendously, more than 5 times. And when I was first training, they used to stay in hospital for about 5 days, 1 week. Now they only stay 1 night, maybe 2 nights only, And the average age of the patients are getting younger, because last time they were closer to 80, now they're closer to 70 because, they're more higher demand, they're more functional, and the implants can last longer as well. Also, the blood loss has decreased significantly, more than 3 times now. And you may ask, how is all this possible? Well, it's because we have newer surgical techniques. We know better approaches, certain drugs to give around the surgery to reduce the blood loss. And our implant design has improved a lot. Last time we had a big 15 centimeter implant. Now we have all this mini stem or stemless design that is cementless. So it's less invasive, it's less blood loss. You have a short hospitalization stay. You have this kind of interconvertible platform system. All this gives a faster recovery, and we have a better understanding of the implant materials and better techniques to position the implants better. So you have longer implant survival and overall better functional outcomes. So the implants are getting better. The surgeons also, I guess, are getting better with better training. They're going overseas centers to train. So what else is necessary? Well, I guess it's education. Education like webinars like this. We need to tell the public, that these advances are out there. You don't need to suffer with your condition. So we do it through webinars like that, or through this is our local Singapore Straits Times and the Chinese newspapers, through the general media, through the magazines. It's important to create awareness. We also need to educate the GPs so they can treat their patients, and also the surgeons. I regularly conduct courses in Singapore and around the region, teaching surgeons how to use these implants and how to get the most out of the implant. So finally, to conclude, I would say the reverse shoulder is here to stay and can potentially help a lot of patients with different pathologies. The graphs here are the national joint registries for all these different countries. And you can see over the years, the RSA procedures being done is just shooting up tremendously in just 10 years. All of these graphs show that. So as our understanding of the RSA biomechanics continues to improve, we'll have further advances in RSA design, better surgical techniques, and superior clinical outcomes. Finally, I just want to say that regarding shoulder arthritis in the elderly, initial conservative management is always acceptable. You can try the plaster, the koyok, the tablets, injections, rest, changing activities. But if all this doesn't help and you're constantly in pain, surgery is probably a good option for you. And the decision for surgery is ultimately based on the patient's age, their activity level, their expectations, and what medical conditions they have, and whether they be able to follow the post-op physio. And now you know that there are newer techniques and implants designs that allow for faster recovery, longer implant survival, and overall better